Welcome to the CivilNet studio, where our guest today is Pat Garcia-Gonzalez, CEO of the Max Foundation. Max has been doing humanitarian work in Armenia for over 20 years. It currently supports over 500 cancer patients here and works in a total of 80 countries. She's here to tell us about overcoming barriers to cancer treatment in Armenia. Thanks for joining us, Pat.
Thank you for having me.
Nice to have you here. So the difficulty for countries like Armenia is that maybe you can identify cancers, you can find them, but it doesn't have sufficient clinical or pharmaceutical treatments. Is that where you guys come in?
Yes, so let me explain a little bit about the Max Foundation. The Max Foundation was established in the memory of my stepson Max, who was diagnosed with a rare form of leukemia called chronic myeloid leukemia more than 30 years ago. And at the time, we are from Argentina. We didn't have a good treatment for Max, and we lost him when he was 17 years old. So this is where we come from. This explains what the Max Foundation does. You know, our goal is that other families don't have to go through what we went through. And the first thing that I learned when I started this work is that for all the really good new treatments that you see in the market, they will never reach people in Armenia and many other countries around the world. So my goal and my life work is to accelerate access to these innovative treatments for cancer in countries like Armenia. And so we have been doing this for 22 years on a constant basis, because now we have really good treatments for cancer. The disease Max had, now you can live a full life by taking an oral medication, a pill, every single day of your life. And so since this medication has been available 22 years ago, we have brought it to Armenia on a constant basis for patients in Armenia diagnosed with cancer. And through the journey of 22 years, I have seen the healthcare system in Armenia improve quite a lot. But of course, there's still a lot to be done.
Well, insights into that would be really fascinating. Yeah, where did you start out and what has changed for the better first?
Yes, you know, when we started, there was very little infrastructure. For example, you could not diagnose this type of cancer and many other type of cancers. Why? Because if there are no treatments, there is no need to diagnose. No physician wants to diagnose a patient to tell them that there's nothing they can do. So we start by bringing the medicine. And once we made the medicine available, then we work with other partners and supporters to elevate the healthcare system to be able to diagnose diseases such as chronic myeloid leukemia. Now, what I have seen, this is my first time in Armenia in 22 years. I have worked very closely with physicians from the hematology center in Armenia for all these years. And what I observe is the high level of training and capacity of all the healthcare providers in oncology in Armenia. I am extremely impressed, as well as the infrastructure that you have today to treat cancer. And what I also have observed is that, you know, if you provide the medicines, that patients in Armenia today can have similar survival as patients anywhere in the Western world. Yet there's still a lot of work to be done because many of the medicines are still not available in this country.
Now, cancer is a very wide variety of diseases, and Armenia has a rather quite high cancer rate, especially lung cancer and well, even ones like colon cancer, which are really, you know, unfortunately not screened for here, or they don't have the access to that. So is the lack of access also a major issue that is still lingering?
Yes, I believe that there is good access to chemotherapy in Armenia. But for any of the innovative medicines, you know, we right now are bringing 6 different medicines to treat not only chronic myeloid leukemia, but other type of leukemia. We have medicines we're bringing for lung cancer and for some rare gastrointestinal tumors. But for the other cancers, there's very little that can be done. And what is unique, and I think not tragic, but it's something that we have to change, is that you have everything else. You just need the medicines to be able to really do a complete care of patients in Armenia. But I have been extremely impressed with the energy and the willingness of physicians to treat the patients. And you know, I think that there's a lot that the community in Armenia, we have many supporters of our organizations that are from Armenia, that are really helping Armenia. And this is why we have been able to bring the diagnostics infrastructure in the last few years. And so now physicians have the capacity to diagnose and monitor some of these cancers, but definitely a lot of work to be done.
And it's going to, maybe now we can dive deeper into what needs to be done, and also, I guess, where you see your organization going in the next few years to help Armenia to reach those goals.
Yes, one of the things I have observed is that the one thing that we have not done yet is to help patients when they have chronic cancer, to help patients live with the disease. So when you're living with cancer, we haven't yet provided education and support. And so I have met with some of the patients, beneficiaries of our program, and I will be working with them so that they can organize themselves and support each other and perhaps form a patient organization. I know that for some type of cancers, for example, for breast cancer, that there's a lot of really good patient advocacy. And for leukemia, I didn't see that. So I think that, you know, in the next few years, we really want to do a lot more in patient support and patient education, because, you know, an educated patient is an adherent patient. And then this is very, very important, since, you know, there's a lot of stigma of cancer. And I think that the best support that they can give is support each other. So this is one area that we hope to increase our presence and increase the support that we give to patients, and also alleviate the burden of physicians. You know, physicians have a lot of patients that they have to see and talk to every day. So, you know, if we can have some educational program, this would be fantastic. And then the other area is, you know, hopefully the government in the next few years will provide more and more cancer treatment. For example, right now, for many cancers, the diagnostic tests need to be paid out of pocket. So for some patients, it's still, even they cannot get diagnosed because they cannot afford to be diagnosed. And so I was meeting yesterday with the Ministry of Health, and this is a conversation that we had, that when the insurance comes, to make sure that diagnostic tests are covered, as well as treatments. You know, I think that you're doing very well in covering surgeries and covering some radiation therapies, but not so much in the medicines. And this is an area that needs some work.
And coming from the United States, it's very unique healthcare system and insurance
Yes.
system, which I mean, we've all heard stories of people who are afraid to go to the doctor because they don't want to be diagnosed, because then they don't know what they do once they got it. And that's part of the education, I believe, that you're trying to go to, break that stigma and fear. There's a lot of fear around that.
Yes, the fear, the best way to break the stigma is to show that you can survive cancer. And so I think that that's a very important part of the holistic support that we need to give to patients. But I have to tell you that, you know, I'm very proud. This was my dream. For chronic myeloid leukemia, after the 22 years, today in Armenia, if you're diagnosed with this illness, you have better access to treatment than people in the US.
Wow.
Because everything is provided free of charge. Physicians have all the medicines they need to treat the disease. So this was my dream, in the memory of Max, to know that other people can live and their families can have their loved one with them.
That's an amazing story. Thank you for all that the Max Foundation is doing here in Armenia, and thank you for joining us.
Thank you so much for having me.
and thank you for joining CivilNet.